So my infusion went pretty well. I had a nurse with me, like she was watching me through the window, but she was basically with me like every 15 minutes, like taking vitals. I mean, vitals will run automatically, take a temperature every once in a while. Um, but it's a 1-to-1 ratio when you do this kind of desensitization protocol to platinum. My infusion, I got admitted overnight because they like to start pre-treating with steroids every 6 hours prior to even getting the infusion. And the as far as the allergy is related to that, the allergist said that that wasn't so much helpful for the hypersensitivity, but if the gyn-oncology team needed it for a different reason, such as nausea or symptoms, side effects of the drug, then they were agreeable to go ahead and give it. So to me, it is unclear why I needed the steroids every 6 hours prior to the infusion. And also during the infusions as prep, I would get a steroid prior to the Doxil, which is the Red Devil, and then also prior to platinum. Wow, my voice is really scratchy this morning. So, I started at 10 a.m. and we did like the pre-meds, and those are about, half hour, 45 minutes. That's going to be like a couple anti-nausea medications. And they're like long-acting ones and more powerful. And then the steroid. The steroid is it's an IV push in a pre-filled a syringe. They draw it up and syringe it, but a nurse attached it to the medication to slowly enter the body. Because the very first time I received this pre-medication of steroid, I was not warned that this would happen, so I was a little freaked out. When it did, it causes an itching sensation really intensely, and it's very warm too. It's like a warm, itchy sensation. It was like across my body, like up here, like upper chest, and maybe in like the arms a little bit, and the legs a little bit, everywhere a little bit, but like very concentrated in certain areas, like the chest and the genitals. And I was like, "Excuse me, sir, what did you just give me? Because we are having a situation," and everybody laughed. It was like me and Bridget. This was my first infusion earlier in September. And me and Bridget, my friend who's a nurse practitioner, and the nurse giving me this, we're all just like cracking up and he's like, "Oh, I pushed it too fast. It happens when you push it pretty fast. Just in the future, let everyone know it needs to be pushed very slow to like avoid that itchiness, but you still might not be able to completely avoid it." So if you're ever feeling that steroid injection and the itchiness, it goes away in like a minute, but it's intensely itchy, like all over your body, but very highly concentrated in certain areas, like across my chest and then down in the genital areas. I was like, this is not tolerable. This is not right. But that's what that is. That's the steroid. So going back to my just recent infusion with the desensitization, you still get the steroids, and they do cause that itchy feeling every time. And they said all patients get it, so it's not like a reaction of any kind. It's just a side effect of the drug, and then it's like a minute and it's gone. Very fast, in and out. So started at 10 a.m., did those pre-medications, and then ran the Doxil. Doxil runs over an hour. And then they started the desensitization protocol. The protocol that they're using now, she said they used to use 3 bags they would change these bags, and that was the protocol. She's like, now it's all in there, like in one bag. They just started this recently. It's all in one bag. And they alter the pump. So like the concentration that is in the bag. I don't know. She never changed the bag, but it's in the pump. And so, like, for a while, it's like every 15 or 20 minutes, she might be adjusting it and making it gradually go up in like how much you're getting, like spread out over time. And then they start increasing that. So, like, increasing the dosage that you're getting through it. So, now I'm just make up numbers. These are not real numbers, but say you get like 5 milligrams, and now you're going to get 5 milligrams in, 20 minutes. Now you're going to get 30 or 40, and then you're going to get 50. And it's all in like the same kind of time frame, except for when you go to the very last 2 or 3, they run them over a little bit longer. And I think it's the last 2, they run over an hour. And the last one is your heaviest dosage. She said it was like 400 over an hour. And most people, if they're going to react, they'll react with their airway or some other kind of emergency allergy. They're going to react on the second to last dose, the 2 highest concentrations, the second to last dose, and then the very last dose that runs over an hour. So during that last hour, that is when I started to feel a little just, I go in and I'm like paying attention the whole time, but my body was a little bit more alert on the last dose. And I'd feel like some pressure in my chest, very mild. Like if it was 1 to 10 scale, it'd be like a 1. I'm like, that's something changed, right? Just a little change. And I'm like looking at my oxygen because I'm feeling that tightness, that pressure, and oxygen is normal. Heart rate is where it should be based on like steroids and stuff like that. And then I noticed my concentration went down to like 95, which is not bad. But if it's always running at 99, 100, and it goes down to 95, so that was like correlating with what I was feeling normal, but something's different. And then it passed within a few minutes. It never got worse. And then I was fine. So I was like, okay. And that was happening like intermittently throughout the hour. And what did happen is I started getting itchy palms. So my palms were I can't say very. Again, it was like a 1 to 2 on a 10 scale. It was itchy. And then they got more itchy kind of towards the end of the infusion, went down to my wrist, and I was having a little color change. It was getting a little pink, but the intensity wasn't any different, but it did spread. And then at some point, I felt little twinges of itchiness, like tingles, and I'd feel them like over on this elbow, over on this wrist, and it would just be like a tingle and it would go away, a tingle and it would go away. Felt it in my feet, a tingle and it would go away. Just these random spots, like intermittently widespread out over time. Over that hour, it'd be like maybe once every like 10 minutes or so, you'd be like, oh, there was a tingle. Oh, there was a tingle. And again, it would never progress. It would never get worse. And then I felt a tingle in my throat. And I was like, we're watching that one for sure, because that's your airway. You don't want that to start closing. So I felt that tingle in my throat, and I was like, and then it goes away. And I'm like, it made me a little nervous. I don't want this to be a very serious reaction again. But it wasn't. It wasn't serious. It was very mild. It was controlled. Then they turned off the medicine. All the itchiness went away. No, like I felt completely normal, like breathing normal, no pressure, no itchiness. The redness and itchiness disappeared. And then they just watch you for an extra hour after they turn it off to make sure you don't have a hypersensitivity reaction, because you can have them later. Like even after a blood transfusion, you can still have like reactions to the blood transfusion 24 hours after. It's very rare, but it can happen. So with this, it's kind of the same thing. They'll watch you for an hour, and then if you don't have one, they'll release you. But you're discharged with an EpiPen just in case you have one of those fluke reactions like after you've already gotten your infusion. So they won't let you go home without an EpiPen. And I also have steroids for home too. That's probably more for nausea. I probably won't ever take them. Honestly, I don't want more steroids. I had a lot of steroids yesterday. Like, it is a lot. I don't know. I think I got like 2 overnight. I got like 4 doses of steroids, like the IV push ones. Ugh. Don't like that so much. So those were my side effects that I had. They were not really a big deal. I was aware, but it was fine. And then because I did so well, like the allergist said, if you do well today, we'll probably consider just moving you to outpatient if we can. Before they used to mandate like you have to be inpatient twice. But she's like, if this goes well, we'll just push you to outpatient and I have to stay at the hospital outpatient. And as long as they have the chair time, like whether you're inpatient or outpatient depends on your chair time, like the availability, because it was a long, 10 to 5:30, 5 o'clock p.m. or, technically it was like 4:30 or 4:15 or something was the end. And then they're watching you. No, it was like 3:30 was the end, and then they watch you until 4:30, and then they can technically start your discharge then. So it's a long day, and then you got to wait for, transport to come get you and things like that. So that's just a real long day, and that's a lot of an ask for a chair time for one single chair in an infusion clinic. That's a long that you have to have a chemo, this specifically type trained nurse with you, 1-to-1 watching you. So that's that nurse's like sole, they have to have the right staffing. And then you also have to have that in the clinic, and you have to have the amount of chair time. Sorry, I got a little chemo brain fog going on, so I'm stuttering a little bit. So be patient with your chemo friends if their brains are just not, they're stuttering and they're not adding up. It's the chemotherapy. So yeah, the nurse and the chair time, that's like a big ask for that type of a space in a clinic. And like on the day that you need it, it's, everything's got to align. So the goal is to get me outpatient connected to this same hospital so they can rush me to the ER and get me admitted right away should I need it. But probably won't. I think it's going to be all right. And then, so that's really what it is. They'll never, at this juncture with this facility, they are not ready to do outpatient anywhere else except attached to the hospital. They aren't ready to do that. So every time I do outpatient, it's going to be connected to this hospital so that I can have access to immediate intubation if needed. And intubation is just going through your mouth, popping your airway open, because when you have this reaction, your airway starts to close and swell. It's just like, you get stung by a bee, you get a hive. Well, this is like something in your entire system now, like your entire system's activated, and your airway can start to swell and close, or like your lips can start to swell, or the mouth. But you start to get that here. If you're swollen and they can't get here, they'll do a little cut and go straight into like the bronchial to get to your lungs to make sure. And they start to ventilate you and oxygenate you through there if this is just completely sealed off. And if you ever see someone with a cut right here or a scar, they may have had, it's little, not like a big one of these, like it's just a little scar down here in this area. If you see it there, they may have been, they couldn't get access this way. They went right here through the neck to save their airway and save their life. Because if you're not getting air, you're going to have, brain damage over time, and then you don't know what's going to happen. It's a very intense thing to be aware of, and make sure you have the right staffing in the right location and things like that. So I don't really fault the organization for wanting to do that, but my allergist said that she has done it for many more years than this organization has, and they did do it in outpatient clinics that were not attached to the hospital. So it's just the comfort level of the organization. Like, they're going to do it their way. They're going to make sure that they're feeling just as confident as these other places before they do that. And that's respectable. Inconvenient, but respectable. I'd rather be safe. So whatever they're comfortable with is good for me. So yeah, after that, just came home, very long drive home. I don't like driving to this hospital. It's been something I've been avoiding, and now I'm not able to avoid it. It's got to happen. So, that's everything. I don't really have anything else to say about it. I have nausea today. You get those IV nausea medications, they last for a long time, and so it kind of handles it. I have medications here for nausea if I want. I'm deciding on if I want to take it or just use some like candy or Gingens or something else. Yeah, that's it about the infusion if you're wondering about desensitization. Steroids, yeah, they make you jittery. They're not making me as jittery this time as last time, but I had epi. I had like a lot of stuff thrown at me. I couldn't sit still for like 3 days. I was just like, oh. I think that now, like, having gone through this again, I think it was the epi, and I didn't get epi this time. There's no epinephrine. That's only an emergency to keep that throat from swelling shut. And I got that last time. And that's not happening this time with this protocol. So I feel a lot more like pretty normal, tired, a little tired, like my body's fatigued, but I'm normal, and just a little nausea, just like a little bit. So it makes me not want to take the medicine. And I had to eat breakfast soon, so I'm open to questions. I'll talk to you later. Bye.